My name is Holly Johnson, and I'm a foot and ankle surgeon here at the Hospital for Special Surgery. I see athletes, I see everyday active people, I see patients who've had long-term problems that has really limited their activity. I see really any patient who has a foot and ankle ailment, and generally patients that need surgical intervention. So I treat bunion deformities, other forefoot, midfoot, and hindfoot deformities. I treat sports injuries, both acute, like fractures or ligament tears, as well as long-term consequences from old sports injuries like chronic ankle instability or foot arthritis, and I treat lots of deformity. So when I first meet a patient, I want to hear their story. I don't necessarily rely on what I've read in the blurb I get or even their patient intake form. I want to hear in their own words what brings them to see me, because ultimately that helps frame how I'm going to treat the patient, trying to get them back to where they want to be, and whether that's a simple level of returning to activities they love or trying to achieve really high levels of sport. So I perform a lot of minimally invasive surgery, and what that means is that I'm correcting problems and deformities, but I'm doing it through small incisions. So it doesn't necessarily mean we're just shaving bone or doing something simple. What it really means is we're doing complicated work just through small incisions. And so lots of people ask me, how does this benefit me, or how does this benefit my patients? And it really is a massive benefit, because when you work through smaller incisions, you're really disrupting much less of the soft tissue envelope around the bones. And so what this means is that there's far less pain for the patient. The majority of my patients take no narcotics at all. They're managed very simply with ibuprofen and Tylenol after surgery. Minimally invasive surgery also means faster recovery. So patients are walking faster, the swelling in their foot goes down faster, they're getting back into shoes, back into activities, back to work much quicker than they would be had we done the surgery open. It's so important to get the surgery right the first time. I do a lot of revision surgery in my practice, and I fix a lot of problems that if the patient had just had the proper intervention the first time, they would have been on their way and on with their life. But unfortunately, they had a complication or something wasn't done quite right. And then the second time around, it can be really challenging to get it right. I have a lot of tools in my toolbox to get the patient back on their feet, but it's much easier when I start with a fresh problem. When I see success in my patients, it's absolutely the most fulfilling part of my job, part of my day, part of my year. When I see a patient who's had an excellent outcome and they're back doing the things they love, wearing the shoes they want, really living the life that they see themselves living, it honestly feels great.